Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, one-on-one sessions, Q banks, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always like to go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient-by-patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of the videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So with that being said, let's get into question number 1 for today. Question number 1 states, the nurse practitioner and NP student are discussing the most common type of skin cancer. Which of the following is the most common type of skin cancer? Is it A, squamous cell carcinoma, B, melanoma, C, basal cell carcinoma, or D, pityriasis rosea? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you are answering what is being asked of you, right? So here the stem of the question states, which of the following is the most common type of skin cancer, right? And so this stem is a prime example of how the question, it can tell you exactly what you need to know. You really don't need to see anything else other than this stem. You only need to know which of the following is the most common type of skin cancer. And the best answer is C. Basal cell carcinoma is your most common type of skin cancer, okay? Question number 2, the nurse practitioner and NP student are discussing similarities between basal cell carcinoma and squamous cell carcinoma. Which of the following is a similarity between the two types of skin cancer? Is it A, actinic keratosis is the precursor for both? B, they're typically found in sun-exposed areas? C, both are highly likely to metastasize? Or D, pearly and waxy appearance? Take a moment and tell me what you got. All right, so stem of the question here states, which of the following is a similarity between the two types of skin cancer? Okay, so the nurse practitioner and NP student are discussing similarities between basal cell and squamous cell carcinoma. So we're looking for the answer that shows the similarity between the two, right? So is it A, actinic keratosis, the precursor for both? No, actinic keratosis is the precursor for squamous cell carcinoma, right? All right, they're typically found in sun-exposed area. Yes, B is your best answer. Squamous cell carcinoma as well as basal cell carcinoma are most commonly found in sun-exposed areas. So you'll see like these scaly areas, pearly, waxy lesions or dome-like appearance in the sun-exposed areas. Like if they're bald head, like a bald head male who doesn't wear a hat, you may see it on their head. You may see it on shoulders, they're with their arm out. You may see it on their back, their face, things of that nature. Okay. Um, both are highly likely to metastasize. No, squamous cell is more likely to metastasize over basal cell, and then the pearly waxy appearance is basal cell, okay? And then question number 3. A patient is noted to have an area of red patchy scaly spots to his shoulders. Upon examination, the nurse practitioner notes that some of those areas have centralized indentations. Based upon this presentation, what is the most likely diagnosis? Is it A, actinic keratosis, B, atopic dermatitis, C, squamous cell carcinoma, or D, basal cell carcinoma? Take a moment and tell me what you got. All right, so here stem of the question states, based upon this presentation, what is the most likely diagnosis? So if the stem of the question is asking for a diagnosis, you know what I tell you. You got to run it back and look and see what the assessment findings are. How are they presenting? What are they complaining of? What is noted on the exam, right? So this patient came in, they have some red patchy scaly spots to the shoulders. On exam, the nurse practitioner notes some centralized indentations, right? So let's talk about it. These are sun exposed areas, shoulders, right? Red patchy scaly spots. We're starting to think of some derm. Remember, I always tell you location, location, location is key with derm as well. Now, although actinic keratosis can appear red, patchy, scaly as well in sun exposed areas, they typically do not have that centralized indentation. Now, actinic keratosis is the precursor for squamous cells, so they have some similar presentation. The best answer here is C, squamous cell carcinoma, because a classic identifier also is that centralized indentation. And that's one of those things where you can differentiate how they look from the basal cell as from the squamous cell. Basal cell is pearly, waxy, and a lot of times will have a dome shape. So it's curved over, whereas squamous cell a lot of times will be red, scaly, and indented centrally. So more like compressed in, where basal has a dome shape. Okay, so kind of the opposite. And then knowing your term. Real quick before I go into terms, basal cell, squamous cell. This is also why I tell y'all with derm, Google those images. To be able to see it will help you visualize what the words are trying to say, so that when you see it in word form also on the exam, you can picture what they're saying to you. Sometimes saying centralized indentation, you're like, girl, what? But just like in my review book, that's why I do a dermatology chart, and I break it down where you have the derm disorders, you have an image of what these look like, you have the description, you have how you treat it, right? And with the derm disorder, when we get to basal cell and squamous cell, I have the image in there that shows you that centralized indentation and that pearly dome. So you can see the comparison of the two to be able to differentiate one versus the other. So when you do this, for those of you who don't have my book, Google it, y'all. Y'all have the resources right here. Just Google it. Google those things and look at it and compare it and thank me later. I promise it's going to help you tie things together. But also know your terms. B, atopic dermatitis is what, y'all? That's eczema, right? Although eczema may be dry, scaly, this is not eczema. You don't have the centralized indentations, and they're more like dry and flaky versus scaly. Scaly and plaques is more psoriasis, and like we talked about, actinic keratosis as well. Even though it's a precursor, it may have those red patchy scaly spots, but not the centralized indentation. So C is your best answer. All right, you guys, as always, I hope you found this helpful. Be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email at thenursingstudio1@gmail.com. The things that I do offer are my review book. You can get it in an ebook or paperback option. They're both linked in the bio of this channel. If you prefer to study independently, my self-paced review course for family and adult Gero is also linked in the bio of this channel. If you are looking for practice questions to test your knowledge and gauge where you are, my QBank options are linked in the bio of this channel. And as always, if you need to book a one-on-one session with me, I always say give us a call, text, or email, because I have a variety of one-on-one session types, and I prefer to gauge what you truly need so we can make sure that you're booking the appropriate session for where you are so that we can help you to be successful on boards. Okay. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.